First of all, thank you so much for taking the time to complete this short training and for agreeing to be a Capstone Field Internship Preceptor for the Middlesex Health Paramedic Education Program. My name is Kyler Goulet, and I am a paramedic EMS educator and the program director of the Middlesex Paramedic Education Program. This presentation is designed to familiarize you with the program's philosophy, its goals, and what the Capstone Precepting process is all about. After watching this video, be sure to attest to viewing it in the Google form in order to receive DPH-approved CME credit. For full transparency, after attesting, your name will appear on a list of our trained preceptors. This list is reported to the accrediting agency as part of our program's self-study. The program we have built is focused on student-centered, pragmatic, and progressive education. These principles closely align with the preferences of adult learners. Our program utilizes problem-based learning in an interactive classroom setting to present didactic content. This model not only provides students with a deeper understanding of the content, but also develops critical thinking and problem-solving skills. The program offers a robust lab experience with realistic simulation. After learning skills on our skills trainers, students combine the didactic knowledge from the classroom with the skills learned in the lab and simulation. All faculty members are trained in debriefing strategies and techniques to ensure that students get the most value out of the simulations. Clinical rotations are started early in the program and feature field experience time with the Middlesex paramedics. This means by the time that students are in their capstone with you as preceptors, they have already completed many hours in the field with our paramedics. Students also rotate through the usual clinical rotations one would expect from a paramedic program, including the emergency department, critical care, respiratory therapy, labor and delivery, and anesthesia. After all of the didactic, lab, and clinical rotations have been completed, students are scheduled for their capstone field internship. The goal of the internship is to utilize trained and experienced preceptors from around the state to help students put it all together. This means putting it all together in all domains of learning. The three learning domains are the cognitive domain, the psychomotor domain, and the affective domain. The cognitive domain refers to knowledge. More importantly, it refers to the ability to apply that knowledge in the synthesis of treatment plans based on assessments. The psychomotor domain refers to skills and ensuring that a paramedic student is competent in all of the required skills of an entry-level paramedic. The affective domain refers to attitudes and ensuring that our students act compassionately and professionally in their new roles. I want to emphasize that students need to meet the competency level of an entry-level paramedic in all domains by the end of their internship. Keep in mind that an entry-level paramedic likely performs at a level lower than you do as an experienced paramedic. It is not fair to expect them to perform at the same level as you do. What can a preceptor expect? A preceptor can expect that students will have most of the requisite knowledge and be able to perform requisite skills at or near the level of an entry-level paramedic. Early in the internship, gaps in knowledge and performance are likely. However, over time, you should expect to see the student grow. This growth is caused in part by your open and honest feedback of the student's performance. What is expected of a preceptor? As mentioned, it is crucially important for student success that the feedback you provide is honest and timely. We also expect that you will work collaboratively with a student and model professional behavior. Remember, you are a mentor to the student. Lastly, we expect that you complete the evaluation sheets daily. We have designed the form to be relatively quick and easy to complete. It is also designed to be completed throughout the day rather than in one sitting at the end of the day. Since feedback is so important, we would like to offer some tips and strategies for providing effective feedback to students. First and foremost, understand that the students want your feedback and thrive because of it. Giving positive feedback is usually easier than providing negative feedback for most people. The old saying goes, praise in public, meaning it's okay to give positive feedback when others are within earshot. Human physiology tells us that positive feedback engages the reward center in the brain for both the student and the preceptor. This encourages the positive actions to be repeated. For the same reason, providing falsely positive feedback is hugely detrimental to the student. Falsely positive feedback encourages and reinforces incorrect or negative behavior. Giving negative or constructive feedback can be difficult and should be done privately. But it is the most important action that a preceptor can take. Understand that negative feedback does not and should not involve yelling at, disciplining, or degrading students in any way. Rather, it is a preceptor stating their observations and working collaboratively with the student on strategies for improvement. Feel free to involve program faculty in doing this if needed. The program wants to have a partnership with its preceptors. We want to be involved in the precepting process whenever necessary. Lastly, providing no feedback is perhaps the most detrimental to student growth. This leaves a student wondering if they are on the right path or not. For this reason, we have asked our students to actively seek back feedback from their preceptors. One technique for providing good feedback while preventing any uncomfortable feelings is to keep it student-centered. Ask leading and open-ended questions to the student to see how they feel about their performance. Questions such as, how do you think that call went? What went well or didn't go well? And what would you change for next time are all great starting points for debriefing a call and providing feedback. Oftentimes, a student will realize his or her own deficiencies independently. If this is the case, assist the student in creating a strategy to improve his or her performance. Discussing calls has a basis in an educational theory called experiential learning. This theory is central to everything we do in the program. Experiential learning was first described by David Kolb in the 1980s. Kolb took the relatively commonsensical idea that individuals learn from their experiences and broke that process into 4 distinct actions, which he called concrete experience, reflective observation, abstract conceptualization, and active experimentation. If we put those ideas into simpler terms, what Kolb is saying is that something happens, then we think and talk about it, we draw lessons from it, we make a plan to improve, and then we try that plan out. The important thing to understand is that this is a never-ending process. Every time we learn something, we apply it to practice and then evaluate the results. But in order for this cycle to work, we must reflect on and think about our actions. When a preceptor debriefs a call with a student, that preceptor is helping the student provide that reflection. The goal is that we have as preceptors and educators is for the student to continue this reflective practice after leaving the educational environment. This ensures that a student will continue to grow as a provider once they have left the program and are working independently. Continued growth not only serves to improve the student as a provider, but it also resists burnout and benefits patients. In order to complete Capstone Field Internship, the students must complete at least 30 ALS team lead calls in a total of 270 hours. A team lead is defined within the program's policies as being an ALS call where the student performs a comprehensive assessment, establishes a field impression, determines the patient acuity, formulates and directs a treatment plan, and then directs the disposition of the patient. All of these actions must be performed with little or no guidance from a preceptor in order to count as a team lead. What this means is that the student is able to act as an entry-level paramedic on his or her own. This doesn't necessarily mean that their performance was perfect. Providing tips and tricks is certainly encouraged, but the main question when evaluating a student is did they operate nearly independently as an entry-level paramedic? Also note that an ALS call is not determined based on the performance of an ALS skill. For example, a student may delegate an IV start to a team member if it is appropriate to do so. As long as the student performs a comprehensive assessment and meets the other criteria outlined on the screen, the call counts. Also, please note that transport is not included in the definition. This means that calls such as an unresponsive hypoglycemic diabetic who is treated with IV dextrose and then refuses transport can be counted as a team lead call. Evaluation forms will need to be completed by each preceptor for each shift. This means that 2 forms will need to be completed if a student is evaluated by 2 different preceptors during the shift. If no calls are completed during a shift, an evaluation form should still be completed by the preceptor to document and attest to the student's hours and professional behavior as applicable. The evaluation sheet used by Middlesex is adapted from the Capstone Field Internship Evaluation Tool published by the National Registry in 2015. You'll note that the form contains some shaded boxes. The shaded boxes are areas that the preceptor should fill out. The top of the sheet is for the shift information. Then the rest of the front of the form is the call log and evaluation criteria. The student will fill in the basic information about the call, including the patient's age and sex, the field impression, and a summary of treatments. The student will first self-evaluate their performance in 6 areas: patient interview, physical exam, impression or treatment plan, skills performance, communication, and team leadership. Definitions for each of these criteria are included on the backside of the form. The possible scores are NO for not observed, 0 for unsuccessful, 1 for marginal or inconsistent, and 2 for successful. Please understand that a score of 2 means that the student is acting at the level of an entry-level paramedic. Although their performance may not be perfect or to the level that you, an experienced paramedic, would perform, the student's performance is acceptable for an entry-level paramedic. For example, a rating of 0 in skills performance may indicate improper IV technique, while a 1 may indicate proper technique but a missed attempt, and a 2 may indicate proper technique and a successful attempt. Also, please understand that prompting means that you need to become involved in order to manage the patient or scene appropriately. This is not the same as working collaboratively with the student. The last column is an area for comments specific to individual calls. Students or preceptors may add additional information in these boxes. Please note that in order for a call to count as a team lead, the team leadership column must have a score of 2. Completing the paperwork is likely easiest done throughout the day. On the back of the form, preceptors should indicate whether or not the student was on time and prepared for the shift. This means that the student should be ready to begin at or before the shift start time, not walking in the door at the start time. Preceptors are then asked to evaluate the student's professional behavior using the same 0 to 2 scale. There is a section for general comments. While the comments on the front of the form are specific to an individual call, the comments on the back of the form are more general. On the bottom of the back of the form are the signature boxes for the student and the preceptor and the definitions of the clinical objectives for reference if needed. Generally, the student is responsible for submitting the form to program faculty as part of their shift documentation. However, if a preceptor prefers to submit the form directly to the program, he or she may do so by emailing it or faxing it to me. Contact information is on the form. Also included is a QR code to access this video and instructions to obtain a replacement copy of the preceptor manual, which will be emailed to all preceptors at the completion of this training. Lastly, I'd like to address some specific circumstances. First, what should a preceptor do if a student is late with or without notification? The answer to this question is that it is up to the preceptor and/or the service. The service and preceptor would certainly be within their rights to turn a tardy student away if it affects the operation of the company. If the student is allowed to stay, document the tardiness on the evaluation form. Timeliness is an attribute of a good employee and something that the program tracks closely. Next, what should the preceptor do if he or she feels that a student should be sent home for the day due to their performance, attitude, or other factors? The answer is to feel free to send them home, but absolutely contact myself, the program director, to explain the circumstances as soon as possible. The program has strict policies regarding clinical performance. If a student is sent home for the day, he or she is considered suspended from all clinical activity pending an investigation. Next, what should a preceptor do if a student gets injured during the shift? Students are not covered by your agency's workers' compensation. They should be treated to the extent that you would treat any patient. The students have the financial obligation for this and are required to hold personal health insurance. Lastly, what should a preceptor do if he or she wishes to discuss a student's performance or any other program-related matter privately? For this, feel free to contact the program director at any time. Email is typically the best and will be returned promptly, typically by the end of the next business day. For more urgent matters, call the office. Thank you for listening. My contact information is on the screen. It is also included on the evaluation form and in the Capstone Field Internship Preceptor Handbook. Please make sure to attest to watching this video by checking the box on the Google form and submitting it. Once you attest to watching this video, a CME certificate will be mailed to you. You will also receive a link to the Preceptor Handbook that you can use as a reference. Again, thank you for your interest in helping our students and helping our program.